Welcome to the Plus Sides Podcast.
All right, all right, all right.
All right. If you haven't been here before, we are the scrabbiest podcast around. So welcome. We are just three girls that happen to be struggling with our own things that tend to relate to obesity. We met in the TikTok community about GLP-1s, Ozempic, wegovy, Mounjaro, all that jazz. And we decided that it would be good to start a podcast to work on advocacy and education around obesity. So our goal is to help others that maybe not be on social media, that might be afraid to go to their doctor and not realize there are a lot of treatments out there for obesity now, that it's not your fault, that it is something that's treatable medically, and that you don't have to be afraid anymore about going to your doctor and having them blame you. There are lots of resources now. So without further ado, I'm Kim Carlos. If you want to know more about my story, I talk about it on the first episode, but just a quick pithy thing. So I suffer from, or I would say suffer anymore, which is good, but I have genetic obesity. And I've been obese pretty much my whole life. I have a binge eating disorder and started when I was 8. I have been on a couple different GLP-1s since July. I've lost 60 pounds and I'm still going strong. I've completely changed my lifestyle. It has allowed me to make healthy decisions around nutrition and movement and all of these things that I always wanted to be able to do, but really never could because biologically something was wrong. So now that I've been able to solve for this problem, my life has just gotten so much more rich and I've become so much more healthy. And I just want other people to know about it. So that's a little bit about me and what I'm doing here. Kat, how about you?
Hey, I'm Kat Carter, Kat Carter 7 on TikTok. You can find me on Instagram, Mrs. Kat Carter, or Loudmouth Bakes on
Yeah.
Instagram, but that's something else. I just want just quickly, I want to hear, can I get some noise for I finally got my office together
Woo!
and I finally don't sound like I don't hear the reverb when I speak.
Woo!
It's not like, hello, 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 hello. Anyway, and it's still decorating. My husband calls it a Prince shrine. So
There
be
it
it.
is. Yes.
It is, and I did not realize how much Prince crap I had until we actually moved somewhere where I could put it all.
Yeah.
Anyway, so I know Kim outside of TikTok, but I kept my Mounjaro really quiet because I still felt like I was cheating because I'm sporty and I love to work out and I suffer from binge eating disorder as well. But when I started to take Mounjaro, it quieted the noise. I didn't. And Kim really helped me feel like the whole TikTok community helped me feel that no, you're not cheating. Obesity is not a moral failing. It's not an issue that you can just fix with diet and exercise because right here, especially on lifting heavy days, I'm like,
Yeah.
feed me, Seymour. But anyway, yes, or like, lay off me, I'm starving. Like, it was, yeah. Okay, so anyway, this is my stand-up practice. I'm just
Yeah,
kidding.
it
It's
is,
not.
girl.
It does not.
Yeah.
But that's
Yeah,
it
it
in a
is.
nutshell. Yeah, I'm a cycle bar addict. I love spinning and weights. And it can I just say it's really awesome to now actually be able to see the muscle that I had underneath there. There's a
Yeah.
six pack down there. I'm gonna find you. I'm
Girl.
gonna find you, Abs. See, I'm gonna find you. Anyway, so that's my story in a nutshell. I was on
Awesome.
what
We're
episode
so
3,
glad
the
to
whole
have
thing.
you here.
So yeah.
Janine, tell us about you and why you're
Hey.
passionate about being on the podcast.
So funny, a Mounjaro commercial just went off.
Oh,
So,
hell.
yeah. But hi, I am Janine Trott. I met Kat and Kim on TikTok, actually. I've been on a GLP-1 GIP Mounjaro for approximately 4 months. I am genetically predisposed to type 2 diabetes, and I have had chronic obesity later in life. So right now I'm technically in the overweight category. Woohoo! And my body is
That's
more
major.
importantly functioning properly. My A1C is being regulated and any other comorbidities that I have. So these ladies, we celebrate all wins, and especially that we're becoming healthier versions of ourselves. So we're being
Yes.
healed from the inside out. The weight
Yes.
is a byproduct of what's
100%.
going on
100%.
inside.
Yes.
So you can find me on TikTok at the Jernine. Same for Instagram because there's only one. And yeah, and I'm a Virgo, and Virgos rock. And my motto is, it is a marathon, not a sprint.
Yeah, totally.
There you go.
Awesome.
Absolutely.
So we mentioned earlier a few times, because we're very, very passionate about it. This is a community that was born, or this podcast was born out of a TikTok community that focuses on treating obesity. So we really want to be able to give voice back to people in the community that have testimonials around these medications about how and the different ways that they've helped them change their lives and better their health. So our product podcast usually will start with a story from someone in our community that will be able to have uncut, unfiltered, raw opportunity to have the floor and tell us their story. And then we're also going to have medical professionals, and we have a special one today. And if you don't know Wait Doc, you should. She's fabulous. Yes.
She's
and
awesome.
She will be on to talk more about the science and the data and all the math to make all this make sense. So we're going to start with inviting on Mary. So Mary from our community, I'm adding her now. Welcome, Mary.
Hey, thank you so much for having me.
Hey, Mary.
We're so glad to have you. The floor is yours. Tell us about you.
Well, first, I just really want to say thank you for having me. This is so fun. Like you all said, we got together through this TikTok community. I downloaded TikTok last summer, and I started getting on my FYP stuff about GLP-1 medications. I'd never even heard of a GLP-1 medication. So it was like wegovy and Mounjaro, and it was Sam loses it and Nurse April.
Oh yeah,
were on my page like real right away. And I'm like, what's this? This sounds really like me. Like, this is really interesting. So at the time, I'd been struggling with obesity. I love how you said genetic obesity. That's and predispositioned for so many things. Everyone in my family is obese. I have one sister, my mother, my father. I have 6 aunts, my uncle. They're all obese. Many of them have type 2 diabetic. There's just it just runs in my family. So I've recently been exploring that genetic obesity line more and more, and it's fascinating.
Yeah, for sure.
Yeah.
But so last summer I had gotten to my heaviest weight of 275, which I'd been there once or twice before. But last summer I was like, I can't do this anymore. I'm so defeated feeling. And so I got on some medicine from a TV commercial. and then I started hearing about the GLP-1s. And I'm like, wow, that's just so fascinating. I want to see if maybe that could work for me. So I followed along for a few months, some creators, and then I ended up making an online appointment to talk to an obesity doctor.
Okay.
And it kind of went rolling from there.
That's cool. Yeah. So I'm curious what what was everything like with the obesity doctor? Like, did you feel like they heard you a little bit more than maybe like another doctor that wasn't a specialist in the area?
Yes. So absolutely. So I felt like, just even getting in a conversation with her, immediately jumping on, she was like, okay, so tell me about your story. Like, what have you done to try and lose weight in the past?
Yeah.
I'm like, I've done everything. I've done Atkins. I've done Weight Watchers. I've done the Special K diet. I've done Slim Fast.
That was the worst cereal.
The worst. I at the time I was on something called Plenity, which was like you take these gel capsules, like 9 of them a day, and they make you feel really full and bloated and horrible. It was horrible. So at the time I was on that, and I was like, I've done everything. Like, I've been on a diet since the first time I realized I was overweight was in 6th grade.
Yeah.
And I feel like I've been on a diet ever since then. I'm also very tall. So I'm 5'11".
Wow.
And so I'm like
really
a big person. I'm a big. That's when I first realized I was a big person, was when I was in 5th grade and I was the tallest person in the whole school.
Oh, wow. Whole school.
And then the whole school, because 5th grade was the highest.
Yeah.
So then we went to middle school and I realized, okay, I'm not just tall, but I'm also broad. I'm a very broad person too.
I can relate.
And in elementary school, I'd been friends with all these, little girls. They were all my little girlfriends.
Yep.
And it just changed in middle school.
Yeah.
I relate
Yeah.
to that too.
Yeah. I
They
can relate to that too. And
became,
I'm sure a lot of people can. What
yeah.
has been your experience on the medications? Like, how have they helped you? And what way have they enabled you either with your health or your weight loss?
Yeah. So when I started in October, I started feeling the effects. I mean, immediately, I felt the food noise within one day. It was like, I
Wow.
didn't know that food noise was a thing. I'd never heard it called food noise until TikTok. I didn't know
Yeah.
what food noise was. I didn't know that I had food noise all day long. I thought everyone had food noise. And I mentioned on one of my TikToks before that, I thought I was like a foodie. I'm like, I just love food.
Yeah.
Right.
I think about food and I'm just like, I'm cool. I'm like a foodie, but I'm not a foodie because I wanted like McDonald's and
Yeah.
Wendy's and I wanted everything all the time and in huge amounts of consumption.
Yeah.
And my husband, I said something to him a couple days after being on this medication. And he was like, wow, I never knew you felt like that. Like, I didn't know you thought about food all the time.
Yeah.
Wow.
So that was the first thing that I noticed right away. It was so quick. And then the second thing that I noticed right away was I was dealing with chronic inflammation and joint pain. And that I didn't realize that it went away so quickly, but now looking back, like even after I'd been taking it for a month, I made the realization that I don't have knee pain anymore. I don't have just this chronic pain and inflammation. And my first month, I lost about 15 pounds. And I think it was all inflammation. My face just slimmed down. I was losing belly fat for the first time in my adult life because of PCOS. And it just things just started happening. Like you said, all these things that I had wanted to do, I have worked out. I have done intermittent fasting. I've done every workout in the world. I've done every diet in the world. And they all work to an extent. But as I got older and in my mid 30s and had kids and stuff just stopped working. Or if it did, it was so incredibly hard to get the results like that other people were getting. And I was working just as hard. And, it was like, I just can't, nothing's changing, nothing's happening. So that was really tough too. And just seeing those results though, like I started sleeping better almost pretty quick. Some nights I still have insomnia when I move up a dose, or some nights, I don't like, I'm not like a perfect little baby sleeping, but I have slept better overall. And I don't snore anymore. I used to record my snoring for sleep apnea. Like every night I would have it on this app that would tell me like how bad my snoring was that night. I don't snore at all anymore. It's so crazy.
Great.
Just so many things that have changed in the last 6 months. And it's things that I didn't know were going to happen. I took the medication originally to lose weight. And now losing weight is like it's the thing that started it, but it's not the most important thing by far. I mean, the way I feel, the energy I have, not having that chronic pain and inflammation.
Yeah, for sure.
Yeah.
Is amazing.
What about like mental health wise? Has that improved for you? I've experienced that, so I'm curious if you have as well.
Yeah, I've talked about that a lot. I'm trying to be really open. Like I have really bad anxiety. I suffered from really bad depression during COVID, especially. I used to be an assistant principal, so I had a very strong position and I was, interacting with others all the time. And due to some health issues with my second child, I stayed home for a while. And that really shifted my identity and like who I was, because I was a teacher. I was a teacher, I was an assistant principal, like that's who I was. And then when I wasn't, I didn't know who I was. And so I struggled with depression then. And then when COVID happened a year later, I really struggled with like, who am I? What do I do if I'm not a teacher? And now I'm a mom and I'm staying at home. And, it wasn't something that I had ever planned on. And so it really just like messed with my mental state of depression, anxiety. And then I found out at 40 that I also have ADHD. So those things all started coming into play with the Mounjaro as well. And I feel better than I've felt in my entire adult life.
Wow. Wow.
That's
which
fantastic. It
is
has
really
helped.
wonderful.
Yeah.
That's so awesome. Yes.
It
Yeah.
really has helped. Yeah.
That's
And
a
that
true story.
ADHD, that diagnosis is hitting a lot of us later in life. Yeah.
Mm-hmm. Yeah.
It is. And I feel like some people even think that's kind of a trend. But in women, older women our age, who, I was a good student, I did everything I was supposed to do, followed the rules, but I have struggled my entire life with severe organization, procrastination, just cluttering. I leave piles everywhere I go. My husband calls me a pile maker. Like everywhere I go, I'm like, oh, here's a new pile and I'll deal with that later, but I never do. Like completing the tasks and my executive functioning. So I've always been diagnosed with depression or anxiety.
Mm-hmm.
And I finally went to bat with
Indeed.
somebody last year, a specialist. And I'm like, you know what? Not saying I don't have depression or anxiety, but I feel like I'm always being treated for those things. And the symptoms are so similar. And so we got to the root of it and started on like low dosage of Adderall. And I was able to lower anxiety and lower depression meds. And now I still feel better, like the best I felt.
That's great.
That's awesome.
Wonderful.
Yeah. I've definitely had a similar experience in terms of the anxiety. So I understand. And I know we did have Dr. Rosen on last week, and he specifically did mention that there is, they find like a strong tie between obesity and with ADHD. I think we're learning so much about how everything's connected,
Right.
Like,
Yeah, it's like still
like, you
ongoing.
hear that song.
Yeah.
Yeah. Like,
Yeah.
it really just
We're
is.
still learning.
Yeah.
It
we
doesn't
are.
surprise me what we're finding out like almost every day, if not every week, about what these GLP-1s are like as a benefit to us, like kidney health, heart health, mental health and everything. But you know what, Mary, have you noticed or have you been experiencing people treating you different due to your weight loss?
Oh, good question.
That is a great question. I have noticed, I've noticed it not so much from my friends because I have yo-yoed for the last 20 years that I've known a lot of my friends and family members, but I notice it more from people who I'm not close with. Like either just acquaintances I haven't seen in a while or even strangers. Like I feel like I get more positive attention, more doors being held open, more just like eye contact and sincerity from people than I did 60, almost 65 pounds ago. And that's
awesome.
That's kind of a hard pill to swallow too. It's like, wait,
It is.
It's like it
was I
feels good,
imagining
but you're
that
also
before?
Yeah. I remember the other day, like I had a guy look at me. I'm married, so it feels awkward even saying that, but he was like the up and down thing, and I thought I haven't seen that in 10 years. You know what I mean? And I thought to myself, why? I'm freaking gorgeous all the time. Like what the hell?
Right.
It does feel good, right? When it happens.
We're fabulous all the time.
I've been here all day. Like what the heck? But I mean, it is a weird feeling, I totally can relate. Yeah.
Yeah.
Or it's that other thing I used to always get, and I don't see it. Well, where men would say, "I love all women," or "I like women with big." I'm like, why do you have to say that? Like, are you afraid someone's going to come out of the wall and like joke you for finding a heavy woman sexy? Because that's possible too. Yeah, that's one of my gripes. I was like, I like big women. You didn't have to tell me that.
It's like,
You could just say I just like you.
Yeah.
Or who's
Right.
going to clown you for doing that? Who's going to come out and joke you? So yeah.
Right. Yeah.
Awesome. Well, Mary, if you would like to stay on, we actually have Weight Talk with us. And I'm going to have Kat.
I would love to.
Yay.
All right.
Oh,
I'm
yeah.
bring
Dr. Jenna Seawalk.
Hi.
Did I say it right?
Dr. Jenna. It's a hard one.
Oh, you said Cywack. I said
Cywack.
And I was telling Kim the whole time. It's like
you were really practicing.
I'm trying to make the motions like, oh, whack.
Cywack.
There you go. Or Jenna is okay.
I could have sworn it was okay. Wow.
It's okay. We're close and we corrected it. This is the scrappiest podcast in the land.
It is. It's
good enough. Wrong. I was loud and wrong.
Well, Jenna.
That happens a lot.
Thanks for having me. Thanks for pulling me out of my shell and making me be here. And
Yes.
yeah,
Oh,
it's great.
So
thank
glad.
you.
So many of us, we love your videos and they're so
Mhm.
informational, and you're such a great advocate for us that struggle with obesity, that struggle with, type 2 diabetes, that struggle with PCOS. Like, you understand
Mhm.
like how these things are all connected, and how metabolically this matters, for our health and for our lives. So I'm so glad that you were able to come on and talk with us today,
Yeah.
and that we were able to have Mary here. Mary, feel free, of course, to join in the conversation. This is meant to be an educational and advocacy podcast, so we would love to have any kind of interjections you may have. Of course, we have given you questions ahead of time, so anybody that wants to come on in the future, it's a warm seat, not a hot seat. So,
Exactly.
but if you could tell us a little bit about you, and why you're here and what you focus on, then we can go from there.
Okay. Well, I'm a mom to 3 kids,
Oh my
1,
goodness.
3, and 4. I always
Wow.
feel like I have to start with that. And then I'm also a physician. So I'm a family doctor first and foremost. I'm also double board certified in obesity medicine. I practice full-time family medicine, and I incorporate obesity medicine into my practice. So that's kind of how that's the balance that I figured out works for me.
Yeah.
Yeah, and I really enjoy it. So I feel so strongly about it because obesity medicine and treating obesity is at the core of almost everything, not almost everything, but so much of the chronic diseases that we manage in primary care. It just doesn't make sense not to treat it. So that's why it matters so much to me.
Yeah. I think that's awesome. I mean, I started my care with a primary care doctor, and they've been taking care of me. I've gotten to the point where I want someone that specializes in obesity to oversee me, because I recognize now, learning through this process, that it is something I'm always going to struggle with. And so I wanted like that specialty, but I think it's wonderful because there aren't enough obesity specialists. So being able to, from a primary care perspective, be able to like tap into that is huge. And I hope more people know, like, you can go to a regular doctor. And if that one doesn't work, then you can look for telehealth obesity practices and things like that
Yeah.
too.
I
So
do. There's so few primary carers who are board certified in obesity medicine.
Yeah.
You can be any type of physician and be board certified. So that's really the tricky part, is we can give people the resources, like, go look here, but that could be an anesthesiologist who's board certified, or a lot are endocrinologists, some are pediatricians. So I do think it's hard to find a primary care. There's one other PCP in my area. Of somebody who has that background, who's using it. So I know I even hesitate to tell people to go look for a primary care who has that board certification, because it's so hard to find. And I think a lot of people will need to use telehealth, but I know you've talked about how your primary care manages your Mounjaro, right?
Ozempic for me.
Ozempic.
I came too late to the Mounjaro party. When I came,
I didn't know that.
no, I started on Saxenda.
Okay.
And then I did that for a while, and then insurance had me switch, and now I'm on Ozempic. And I'll probably cut that out soon, to be honest. But it's going really well. But yeah, so that's when and then maybe Mounjaro will come around for obesity, and things will be different. But obviously not a lot of insurance covers that yet. But speaking
I
of,
think a lot of PCPs, even who are willing to manage it, don't necessarily know how to adjust it, or don't know how to keep the frequent contact, or aren't willing to do the PA. So yeah, it's a huge struggle. But I feel like obesity medicine should be something that is worked into a primary care residency program, and it could be, but it should just be part of the core training for that. And maybe one day it will be. It would just make sense. But yeah, right now
I hope so.
Yeah.
We've definitely learned lately that it's and from several people, that it's like, it's unless you choose to go back or set aside to get certified in those areas, like, it's not something that's readily taught.
It's not at all. No.
Yeah. So I think that's why it seems like that's a lot of the reason why that, like, we see a lot of doctors that don't really know much about it. Like we had I don't know if you know Bourbon RX, but he came on, he was like, like they told us, like, literally the focus was, if you are obese, you're going to have a heart attack or get type 2 diabetes. Stop it, eat less, move more. And that's what we've all been saying forever. Like, and so we're like, maybe there's another way. Like, there's science and data to back this up, But speaking of all these GLP-1s, there may be some people that don't know what these actually mean or how these actually work?
I don't think a lot of physicians even do. And I do think that's a big part of I mean, yes, obesity, stigma, weight bias, I think that's a big part of it, but also they have not learned. And so I really do think we're going to start to see that change. So I'm 5 years out of residency. And when I was in residency, the big GLP was Trulicity. It was once a week, and that was the big one. And so I got out of residency and I was using that. And then I realized the endocrinologists were prescribing Ozempic. And I was like, ooh, what's that? And that became the big one. So it's just when you think about how new the ones that we utilize for weight management are, it's still really new. So it kind of makes sense. But even in like a typical primary care residency program, it's still not all PCPs are even going to be comfortable using those for diabetes management. So I think the weight management piece, they're definitely not comfortable with that. Not the average PCP, unfortunately. So I do think it's going to change drastically in the next 10 years or so. And I'm really excited to be part of that.
I think the common misconception that I'm hearing for people that like will comment on my posts or videos or whatever, they'll say, oh, okay, so it's just an appetite suppressant. And I feel like it works very differently in the body. And you have described that in some of your videos. Could you kind of just give us like a rundown of what that looks like for people maybe who don't know that are listening?
So I always tell people there's a couple of different ways that the GLP-1 medications work. They do work by increasing satiety. They slow down gastric emptying so that the food is just moving through your body slower, so you get fuller quicker and you're less hungry. But they also work on the insulin resistance portion, so they affect the insulin and the glucagon release and help your body regulate blood sugar. So I still would say that the main way that these medications work is by making you feel fuller quicker, but they're not an appetite suppressant like what we typically think of, like phentermine. They're not a stimulant. Totally different than that. And they work on that insulin resistance component, which is really important for people with PCOS or prediabetes or diabetes type 2 or any degree of insulin resistance, which we know there's a whole spectrum. So
that's very cool. Thank you. We have noticed, like, speaking again, like about people who don't know a lot about these medications, we have seen some celebrities, back to the title of the episode.
Oh yeah.
Which is obesity medication and media and celebrity fearmongering. So we've had several people in the media recently. I think one you even made a video about.
I did. Those are
Jamila, right?
Jamila, yeah.
And then Jillian Michaels and Bethany Frankel's, all people kind of speaking out against these
things.
Because apparently they're doctors. Apparently they are. So we'd love to hear kind of what's going on with that. What's your opinion?
I'm trying to remember. They all blend together. Bethany Frankel was the most recent one, and I actually really enjoy watching Bethany Frankel. I just watched her talk about makeup. It's like she's so good at what she knows. She's so good, but just stick to that.
Stay in your lane.
Stay in your lane. Yeah. Her most recent video where she talked about Ozempic, it was just so out there. It was all over the place. But the biggest thing that she said, I think that irked a lot of people, was that, of course, it's a shortcut. Talking about surgery or meds or pretty much everything. Well, of course, it's a shortcut. No, it's not a shortcut. We know that obesity management is typically a long-term, lifelong thing. So, and there's a lot that goes into it depending on what route you go as far as medications or surgery. And it is not a shortcut. But that was like the one thing that she said that just stands out to me, the shortcut thing. She said a lot of other horrible things, but that was the big one.
Yes, she did. And we hear that a lot too. And like Jillian Michaels came on and was saying stuff like, I got all my family to stop taking Ozempic or something like just crap like that. And I'm like,
good for you.
Who are you to tell your family who is something prescribed by a doctor to stop taking it? Like,
and you read through the comments of hers, and it's just, that's what's so maddening, is she has such a large influence on like millions of people, and so many people who will just believe anything that she says. And that's what frustrates me so much is it's like an abuse of power and privilege and position.
100%. And I think they also are confused, or maybe they don't care, I don't know, about what's obesity and what's to 15 pounds, right? Like these are obesity is a disease, right? They're very different things, and they're kind of lumping it together. And she talks about like which is Ma Wang and like all this different stuff. And
I
the
had to
only
look
way
up what Ma Wang was. I was like, what is
what is that? I don't even know.
I think it was a little bit before a lot of ours time, but
it'd be like a little bit like being kind of tone deaf, like you're not really understanding
No, and they will, and
From
what
the
they
other
all do
perspective.
too, they'll the moment we call them out and we say the obesity is different than just weight loss, they'll say, "Oh, we didn't mean obesity. We meant for the people who are trying to lose 5 or 10 pounds. We didn't mean that."
Right.
And even she did that in her follow-up video. She kind of fell back on that, but then still said a bunch of insulting things. It was just like, ugh.
It makes me think of with Jillian Michaels, The Biggest Loser, when statistically majority of those contestants have gained all of their weight back because their metabolism was so jacked up after the show.
Yeah.
Yeah.
Yeah, the Jillian Michaels thing is also infuriating. She is one I remember doing some of her videos like in high school, and so I really hate that she is out there talking like that. I really liked her.
It's sad because she was like, and if I had been a contestant on that show, many years ago, and then you hear her, the way she talks about obese people, like it's really disheartening. You were supposed to be kind of a supporter of, anti-obesity and helping people get healthy, but really you're just shaming them.
Yeah. I felt like she was shaming them on the show. Like the few times I did watch it, I literally was just like, is she really yelling at them? I mean, like yelling full force at people that are doing their best, and they were doing whatever they could to make sure that they met the number for weigh day. And I just never could get with that show. But
it's just diet culture, like 101. Like, I don't know about y'all, but diet culture broke my ass. Like, I've been still getting through. Like, that's one thing that I think the medicine does allow me to do too. I don't know if you guys can relate, but like, it's allowing me to heal my relationship with food and allowing me to get away from like those unhealthy ways of losing weight and thinking about more about nourishing my body first. And if I want to have an Oreo, I'm gonna have an Oreo. I mean, I think it's really, I've been really trying to break. I mean, there's so much mental work I think that goes on top of this when you've been in a larger body the majority of your life, so there's a lot of work to be done. But like, speaking of anxiety, we mentioned that earlier. Mary even mentioned that she was struggling with some anxiety. And I mentioned that, like, even with me, with the food noise was kind of all the noise was gone for me. It wasn't just the food noise, and so like all my anxiety kind of just like just turned right off. It was kind of incredible. But Kat had mentioned about like addiction, right, Kat?
Addiction. Yeah. There's I've heard some stories where people say like their cravings for smoking, alcohol have also quieted. Not only just the anxiety and the food noise and the white knuckling, but a lot of that has also subsided as well after taking a GLP-1.
There is science to support that. I know that's like a heavily researched area currently, but there are GLP receptors in the brain and the reward center and in our center of the brain that regulates emotions and mood. So it is definitely possible. I almost hate admitting that right now because then the Bethany Frankel thing that personality changes, right? But that's not what we're talking about. But there is science to support just with the GLP receptors in the brain. The other piece that I do think plays a big role is it depends on what your anxiety is about. And I know you mentioned it's not more than just the food noise and the food chatter, but for a lot of people, they do have anxiety around what they're eating, especially with binge eating disorders. And health anxiety. So if a lot of their health conditions are improving and they no longer have that food noise, and that food noise is just gone, their anxiety is going to improve too, because the source of that anxiety is gone. So it could be a combination of it's probably both of those, but we don't know a definite mechanism by which it would improve anxiety yet. Like if we look at a lot of our anxiety depression meds, we know, okay, it works on the serotonin or the norepinephrine and dopamine. And there's theories that it's doing similar things, but we don't know that much detail about it yet. But I think more will come out, and that's a common thing I hear from my patients too, that their anxiety is improved, and it's really, really interesting. I have not had any patients who've quit smoking. I've like secretly hoped a couple would quit smoking on it, and that hasn't happened. So kind of disappointed in that, but so I haven't seen that too much. But I know some people do say that it helps. Yeah,
and I've heard other people say sometimes that it doesn't, that it goes the other way and causes more anxiety. And then I know there were some studies that kind of talked about the difference between like anxiety and then like depression and like, how those were kind of looked at in different ways. It was more of like improvement with anxiety as opposed to improvement with depression. I was thinking I saw one of your videos about that. Maybe it wasn't yours.
I don't think that was me.
Was it yours? Yeah.
But it'd still be similar, and I would say it's probably going to be a similar mechanism. It still all stems from that same area of the brain. So yeah, I think there'll be more to come on that, and I'm super excited.
Yeah, I'm excited to see how it goes too. Because I can't help but wonder, just like as a person that goes through it, was it always food noise for me? And that it just got so bad that I started to obsess and have anxiety about everything. Yeah. Do you know what I mean? Like, was it always food noise? Was it always the obesity and it just like snowballed? I don't know. I'm super curious to see how that turns around, and like what those studies look like for sure.
Yeah.
Yeah.
And food noise, that the first time I heard that was on TikTok, and I use it all the time.
Yeah.
So that's
me too.
From the TikTok community.
Like,
and
I don't know who started that.
Yeah, I don't know. I mean, I heard like food chatter, food noise, and like I remember the first time when I found somebody on TikTok, they said, they were like, you want to like most of this medication, the quiet. That's what because it wasn't even like they were saying food noise, and I was like, oh my God, that's right, the quiet. What's up with the quiet? It was so loud in here. What happened? And then that was when like, so people that don't know what we're talking about, it's just like what Mary was talking about, constantly thinking about food, constantly thinking about ingesting food and eating food. And it was
that's a lot of energy that goes into that. I mean, so just freeing up all of that brain space to be able to think about other things. I mean, that's really incredible.
That's a good point.
It really is.
That has to be good for mental health too.
Right. And with binge eating, like, because I did Overeaters Anonymous, many as well, is you got to teach yourself how to turn that off. And they tell you the reason why you're binging is because you're stuffing emotions, you're stuffing feelings, you're stuffing anxiety. And I have noticed that when I started taking Mounjaro, it's making room for me more feelings. Like I caught myself with a little bit of anxiety today about some other opportunities, other things that I'm working on. And I realized I'm like, I have not felt this in a while because it's allowing me to feel. And then, well, you can't eat now, so let's lean into it and go with it. So it does kind of help clear things up.
It sort of like allows you to kind of stop and start. Like, wait, what's happening? What am I doing? Instead of like just leaning into the behavior. Like, it's
an escape.
Like kind of like anesthesia for surgery. I always like that analogy, but and that's usually how I'll explain antidepressants and anti-anxiety meds to patients. But you wouldn't go through a painful surgery without anesthesia. Well, most of us wouldn't.
Right. But I definitely wouldn't.
You wouldn't. Yeah.
I wouldn't.
The moms who go through labor without an epidural, I would never do that. Some people like that. I don't know.
Some people do. I'm not that girl.
No glory in pain.
I have some friends like that. I do, and it's okay, and I love it.
But if you're super depressed or super anxious, it's hard to do the work or to do counseling, to go through the thought processes that you need to heal. So it's like the antidepressants, anti-anxiety meds are kind of like an anesthesia so that you can actually do what you need to do. And I feel like the GLP meds they're kind of like that too. So you can, like you said, you can kind of take a step back and think and see how you're feeling and look at behaviors and
and make like conscious decisions. Trini, I think you had a question that you wanted.
I did, and this one is kind of a warm topic.
Oh, okay, go for
it. well, only because we have so many new members to the GLP-1 community, and I find that so many of them, and I think all of us can attest to this, that they're very apprehensive, if not scared, of the side effects of these medications. And, I know that I openly talk about mine only to be transparent, but they're like, I want to start, but I'm really afraid of the side effects. And I know as a doctor, you hear this also, but my question is, can you talk to us about the side effects, and also are the side effects usually manageable? So, just to kind of educate people on this.
Yep. So I I think it is important for people to be aware that there are common side effects that get better with time that are kind of expected because of how the medication works. And so that's always a big discussion that I'll have. People do have to know about the potential side effects. So just with the way that the medication works, with it slowing down gastric emptying, a lot of the side effects are going to go along with that, and they're going to be gastrointestinal related. So I tell people they should expect to some degree mild, manageable side effects, at least with starting the medication. That should improve with time. It should be tolerable. If it's not tolerable, then it's not the right medication or it's not the right dose, because it shouldn't be severe. But nausea, heartburn because the food is not leaving your stomach as quickly. So if people eat like close to bed, or as even when they normally would eat, that food could still be in their stomach. So they might find that they have to adjust. They can't eat as close to bed. They can't eat certain things that are going to trigger heartburn. They have to eat smaller meals, but people usually will adjust. So heartburn is a big one. Nausea. And nausea usually is the first 2-3 days after an injection, and gets better and does usually improve with time. And we can also make that tolerable by having like Zofran on hand is appropriate for most patients. So I will usually offer that when I am starting a medication, and I think it's totally fine to have that on hand, as long as it's not needed like 4 times a day forever and ever. And then constipation is the biggest thing that I see. And I think it's really important for people to stay on top of that. So some people will ignore the constipation until it gets to the point that they're having, bleeding hemorrhoids. And we're like, okay, now what are we going to do? If people kind of expect it, they'll know like, okay, I need to start Miralax. I need to start magnesium. And there's a lot of different remedies for that work for different people. So like magnesium citrate, and none of this is medical advice, by the way. I'm just going to throw that out here. General
disclaimer.
Should have done that at the beginning, but yes, all this is educational purposes only. But magnesium citrate can be really good for constipation, especially for people who just aren't going to do powders, because a lot of people just aren't going to do powders. But otherwise, Miralax is great. Fiber is great. I think the little Miralax fiber cocktail is great. I think a lot of people on here do that. But there's a lot of ways. The point being, there are so many different ways that we can manage constipation. And that is the number one side effect that I've seen with Mounjaro is constipation. But it has not been so severe that anybody has quit Mounjaro. So those would all be common. Less common would be like profuse vomiting. And if that's the case, that if someone on TikTok is talking about that, often that's going to be someone who was put on too high of a dose, so that's more like a doctor error. But it may not be, but profuse vomiting would not be a common side effect. And then the ones that people are typically scared of are pancreatitis, which is not at all a common side effect that we see with GLP meds. It's a common side effect that we see with diabetes and inflamed, angry pancreases. And thyroid cancer is the big one, which there's no good conclusive evidence that these medications cause thyroid cancer unless you're a rat. So as long as people don't have that specific family history or personal history of that medullary thyroid carcinoma or MEN2 syndrome. Medullary thyroid carcinoma is usually genetic as part of MEN2 syndrome, and it's very, very rare. I've still never had a patient who had a family history of medullary thyroid carcinoma. It's that rare. So we usually see papillary thyroid cancer, follicular, some other type. It's rarely medullary thyroid carcinoma. So that's the only true contraindication to these meds, is that particular history or family history because of the rodent studies. So
I do know some rats that masquerade.
If you're related to rats. And that's not to say like I don't think we can 100% say like, okay, this is never going to be an issue. It's just that it's really hard for the studies to make that determination because it's such a rare thing anyway. And we have 20 years of data, so they're not brand new, but we don't have 50 years of data. So is it possible that 20 or 30 years from now they might say, okay, yes, there's absolutely a small increased risk. I think that's a possibility, but I don't think it's going to be a large risk. And there is a risk of thyroid cancer anyway that is related to obesity. So it's always going to be risk versus benefits, and what are the risk of going untreated? What are the risk of untreated obesity and diabetes? And there's like 12, 13 different cancers that are associated with obesity. So we always have to weigh the risk and the benefits, but for most people, the benefits will outweigh the risk.
And I'm so glad you said that, because that's what I that's what I say, is that the benefit definitely is more than the risk. And another side effect that we're hearing more about is hair loss. And we're seeing it in the media also of these drugs cause hair loss. And I thought it was rapid weight loss will cause hair loss, not necessarily these medications. Can you explain that and briefly discuss that so we're more educated on it?
Yeah, and as far as I'm aware, I don't believe there is a mechanism by which the medication causes hair loss, at least not that we know of. So we think that's more just related to the stress of, it could be the stress of a new medication on the body. It could be from the stress of the weight loss. And personally, I've not had patients experience hair loss that haven't had a pretty significant weight loss. But we can experience hair loss after any big stress. So it's the same type of hair loss that we see after as a mom, after we give birth. It's 3 to 4 months later we start losing hair, and that can go on for several months, and then it stops, and it feels like it's never going to stop, and you feel like you're going bald. And I feel like I've been there constantly the past few years.
I bet.
Yeah, I bet.
It comes back, and it usually does.
I guess
does come back. Yeah. So so that can definitely happen, but we think that is more related to the rapid or significant weight loss, maybe due to some nutritional deficiencies, which is definitely a possibility. So not getting enough protein, not getting iron, not getting vitamin D. So having those levels checked, like an iron level and a ferritin level, not just blood counts, would be one good thing to do. So thyroid levels. For people who are prone to that. So I still think it deserves a workup, just like anything else, but it's not an unexpected thing. And we don't think it's because of the medication right now. We think it's from just the lack of nutrients, maybe a deficiency, or just the rapid weight loss and the shock to the body.
Gotcha.
And then it usually grows back, you said,
it almost always grows back. So if that were to go on for so long, like say somebody is in a constant state of severe stress can cause that type of hair loss. If you never get out of that stress, then maybe it could be a more permanent thing. If you're in a chronic state for many years of iron deficiency, then maybe those hair follicles aren't going to start regenerating. But typically it will reverse. Like, so the idea with the weight loss would be when the rapid weight loss, or when once you reach maintenance, we would hope things would level out. I don't think we've got any good studies on that right now, but I'm very hopeful that hair would come back.
Yeah.
But I know it's a big worry for a lot of people. It's a hard one.
Yes.
Yeah, your hair is everything, right?
It is, yeah.
Look, all right, so go ahead. I'm sorry.
Oh no, I was just
look at your hair. Yeah. And also, like, how do you tell if it's age, your hair is thinning out, or I haven't had kids, or the drugs, so I get it though.
But and that's the other thing too. Like a lot of my patients are like perimenopausal, menopausal, and so that's going on too. So and I think that's another thing. You still have to look at all potential causes, because it could be more than one thing. It could be multiple causes, and and we know that menopause and perimenopause is something that is getting a lot of attention now too, and something we're starting to treat more with hormonal therapy. So that's definitely an area to look at too. Yeah.
All right.
Awesome. Thank you.
There's a myriad of factors working around that, right?
Yeah.
All right. So I have another question for you. The GLP-1 community we're now empowered because of doctors like you.
Yeah.
Thank you. And being advocates for ourselves. But our GLP-1 community that's listening, how can they leverage the medications that treat obesity and work with our physicians to find a maintenance dose to kind of live happily ever after? Or essentially, how do we work with our physicians to find that dose, that sweet spot?
Is it more with how do you convince your physicians that you need to be
You know what? Yes. Let's put it that way. How do we approach that sensitive topic? Because a lot of doctors will say, it's time for you to get off of it. How do we approach that? Or
that is a really hard one. I'm trying to think of how we would convince them. So I know, like, I have a lot of physicians who follow me. And I think that that's one of the best ways we can teach them. Like, I'm always paying attention to the new things that people are saying about hormonal therapy. You know, even on TikTok, that's one of the ways we learn. So when you see other health providers, if you trust their opinion and they're saying, hey, like we need maintenance dosing, I think that's really big. I think it's harder for patients to convince physicians of that. Other than, say, bringing in articles or bringing in something where you think they're going to respect the opinion. You know, I don't even know what kind of article that would be, because probably bringing in TikTok videos is not going to have have a lot of sway with your physician. But I do think bringing in data, bringing in articles by like someone who's board certified in obesity medicine that is saying like, hey, we need maintenance dosing and here's why. I think that would be helpful. Because sometimes if they just don't know, they're going to be happy to have some sort of a guideline. And that's the hard part, because there aren't real guidelines. There's just opinions right now. But yeah, I think that's going to be another thing that will change, but it could be very hard to convince a physician who's not ready to hear that or who does not believe in that. Because the issue is a lot more than just what their opinion is on maintenance dosing. It's probably, you know, when and how they would treat obesity with medications anyway. And so a lot of that just goes back to that basic understanding of we need to treat obesity like any other chronic disease. But yeah, I think always appealing to them, like, this is helping me manage these multiple other things, always going back to your comorbidities and the logical side of what else it's doing for you is really important. And yeah, I would just say something like, you know, most experts in the field believe there should be maintenance dosing, and I would try to show some sort of proof about that. I've had a lot of patients for other things that will send me, you know, articles and you know, and things they want to try. I'm like, oh, that makes sense, okay, but it's because they sent me an article, and that's, you know, we're driven by data, and I think that's always going to be really important when you're talking to your doctor, if they're not on board.
Right. Yeah. A lot of some other doctors that we've talked to, some of them will just say, well, you just need to find another doctor.
And that's the thing, it's probably not going to be worth your time trying to convince them, you know, maybe once, but you're not going to spend so much energy trying to do that. And probably not going to, I just don't think it's probably not going to work. You can only say so much. And I think it's like, they've got to be in the right place. It's got to come from the right person, and it may need to come from a peer.
Yeah.
Right.
Yeah.
Yeah.
And these medicines, like you mentioned, sure, we have 20 years of data on them. Like, they're not brand new. Like, they continue, I think, to be more refined and continue to be better and better. They've kind of, like, again, cracking the obesity code. Like, that's what we're talking about here, right? But I think that it's still, you know, with it just now having the, you know, indications for treating obesity, like, it's only been a few years, right? So it's like, what does that best practice even look like yet? You know, and I don't know if there's data on that or not.
No, there's not. And other than we know that we need something. And we have quite a few years of data, but those older GLPs really didn't give a lot of weight loss. So we weren't looking at them for that. And we just didn't utilize them as much. Like, Bydureon was kind of horrible. I never used that one if I can help it, but people would get like the Bydureon bumps. A lot of people would get nodules at the site of injection. We don't see that with we don't usually see that with other GLPs. So it's just like, people did not want to be on these medicines the same way that they do like Ozempic and Mounjaro. So they're in the same class, but it wasn't the same.
Yeah. Well, as a type 2 diabetic, and someone who is genetically predisposed to diabetes, we saw that you recently made a video about the diagnostic criteria for diabetes, and thank you for making that. And but my question is, in your experience, if a diabetic patient has not met their weight loss goal, but their A1C is below 6, do you still titrate that patient up to meet the weight loss goal? Or since the A1C is now below 6, do you?
So I have a lot of patients that I'm using GLPs like Mounjaro just for weight or for obesity treatment, some for type 2 diabetes and some for both. But yeah, you can titrate up to either one of those goals. You know, we know that Mounjaro by itself without other types of medications like insulin that cause low blood sugars. It's not going to cause low blood sugar. So you would titrate up until we're seeing the weight loss result that we want, as long as people are tolerating it. And not that it's all about the medication, but until we're seeing the appetite reduction that's helping get rid of the food noise, and the medication is well tolerated, and they still have an appetite to the point that they can take in the nutrients that they need. So I will titrate up to the appropriate dose from a weight perspective. Yeah, I will. But there's not a lot of guidance on that, and so that's the thing. It's just it depends on what your physician thinks. But so that would be no different than like in the case of somebody who has diabetes, but the A1C is normal, but they still have obesity. I would titrate up the same, just like somebody who we're treating just for obesity. But it's kind of, I think this is where medicine it's science, but it's also an art, and there's not a lot of guidance with this right now.
Yeah.
Okay. Thank you.
Yeah.
All right, I got something fun for you.
Sure.
So I love watching your TikToks, and so you had one. It was over the holidays. I think you and your sister made one together. Was she a personal trainer or physical trainer?
She's a certified personal trainer, and she's a nutritionist by background, and she does kind of some different fun stuff. Like this is what she does for work too. She'll take clients on one-on-one and do like personalized nutrition. Yeah.
So cool. Have you, your sister and you have thought about maybe like bouncing ideas off of each other or working in tandem sometimes?
We do. No, we definitely do. And I've had like a lot of her clients that then will come see me, as their physician. So that's the biggest way that we'll collab. But yeah, she'll really pay attention to diet. Like she'll do this thing where she'll have people tell her everything they're eating, and she'll kind of give them like real time feedback on what the choices they're making, or things that might be better. They're at a restaurant, whatever. She'll look it up and give them some feedback. So, and she has really good success. I mean, more than, I would say, without using GLPs, more than any doctor is going to have. So it's really fun to see. And she's by no means a therapist or anything, but like she will like peel away those layers like an onion and get to the core of like, what trauma happened a long time ago. And it's very
it does.
So she'll but we've had a lot of people that then she will send to me, and we might start a medication. But I feel like a lot of the people that she works with, it's very different group of people than usually who I'm working with. Usually what I've seen with her is it's more people who don't want anything to do with medications. They feel like they have to do it all on their own, and they want to do it all on their own, and they aren't really that interested in meds. It's just like a totally different, different world.
Yeah.
But sometimes our worlds do intersect, and we try to make them intersect sometimes. I'm not at all in the bodybuilding world like she is. Like it's not an interest at all. So it's, it's just, I don't know. But we do throw ideas off of each other a lot, and I'll definitely go to her for my food questions, and she'll ask me about, if someone might be a good candidate for meds. And
that's good.
Yeah,
it's good that she's open like that. I feel like it was hard enough to get doctors to come around. You know what I mean? Like, and now we have doctors that have kind of come around and realized like this is a path forward, a very effective path. And now I think it's great that we have like, nutritionists and dietitians that are starting to be like, sure, like let's talk about the combination of all of these things.
Right. There's also a lot of, I've experienced a lot of disordered eating also in the fitness community as well. So that can really help also.
Yeah.
Well, what I believe Bourbon RX broke the news last week that Hippocrates now has Mounjaro for chronic weight management in adult dosages. So everyone was just all ablaze with that news, and we're just so happy. So, but with that indication, do you see that as a move in the direction of Mounjaro being approved for obesity treatment? And also, how do you think that move with Mounjaro being in Hippocrates for chronic weight management will affect insurance companies?
It's not going to affect insurance companies. I was not that excited about it. Like, I'm surprised it's in there, and I don't know how they get all their information, but it must have pulled in from somewhere. But but it doesn't mean, it doesn't mean there's an FDA approval yet. It doesn't mean that, insurance companies are not going to cover it for weight yet. Like I don't think it means much, but it is exciting to see. Like, it's exciting to see in writing. So I saw after you posted that, I looked on my app. It had not updated in my phone app yet, or maybe I need to update my app, but I did see it online. And that it is a big resource that we use. Like, it's my main resource that I use for quick references for meds. So I think it's really exciting. So all that means is that it pulled in from somewhere, that it could be used for weight management, or that whoever was editing Mounjaro in Hippocrates wants to use it for weight management. I don't know. But I was maybe a little less excited about it than you.
That makes sense. I mean, I think for us in the community, the reason we were so excited about it is because there've just been like it's almost like everything's being done in this vacuum right now, like with the FDA and the approval for this. And we've seen like massive results, right, with Mounjaro and our community, and so many people having their lives completely changed and their health completely changed. And I think that for us, we're like, that's movement. That's a step. Like,
it is still a step.
Like progress, like, and it's in writing. Like, I think that like that's why we were so stoked, right? I don't think it necessarily means a whole lot for a doctor, but because they were like, oh, there's guidance on how to use this, like maybe that's a step.
But there wasn't really guidance. So like, I looked it up, it just says, list all the dosages, and it says for maintenance. Like, I don't know, there was no guidance, but it was there. But I think it pulled that information from somewhere. However, Hippocrates does things, and it is still cool, but it doesn't change anything. We're still waiting for the FDA approval for the obesity indication.
I appreciate that candor.
Well, I mean, everybody has different perspectives, and that's what we share on this podcast. Is we're going to have doctors on that will talk about compounds that feel very comfortable with them, and then we'll talk doctors who I know, even like yourself, like there's not enough information on for you to feel super comfortable. Like, you've been very open about that, so like I think it's important for us to get all these different
absolutely.
It's educational, right? That's what this is for.
Yeah, definitely.
For sure.
So in terms of where people can find you, we know one of them is TikTok, but where are your other areas, or where can people follow your work?
I'm mostly on TikTok. I have an Instagram that just is there in case TikTok goes away, and maybe I'll use it one of these days again, but I can't get excited about anything else. Like, nothing else is that exciting. That's how I feel. Like, the TikTok world is so fun. That's the only two places I am right now. I'm thinking about YouTube Shorts, but it's mostly like thinking, okay, if TikTok goes away, but they always say that it never goes away, so I'm not really too worried about that right now.
Yeah,
I know.
I don't know. Things are weird.
I'm on Instagram at weight.doc, but there's only so much there. It's mostly on TikTok.
Mostly on TikTok. Well, there's lots of really good TikToks, so for sure people should follow you there.
Yes.
Yeah.
Well, we've come to about the end of our time. But thank you both so much for joining the podcast and helping us with this initiative. We appreciate it so much.
Thanks for having us.
Thank you. Thank you so much for inviting us.
Episode complete. Yay.
Yay. So exciting.
We did it, Mary.
This is the first successful time we've had Community Plus Doc. The last time Dr. Rosen ended up being in emergency surgery. So we'll be 2 different episodes.
Emergency surgery. I was thinking, what if I did a call? I was thinking that, but emergency surgery, that's like another level of call.
Yeah.
That's funny.
So true. Well, I'm so glad you were able to come. Yay.
Yeah.
And I know it's the end of your evening and you're wanting to go be with your family. So thank you so much for taking this time.
Yeah. Thank you for having us.
All right, everybody. Well, I'm gonna duck y'all out so we can do our class.
Thank you. Thank you all.
Thank you.
Yeah. Thanks. Bye-bye.
Oh, well, that was awesome.
That was amazing. That was amazing.
Yay. Such a good one. It's so good to hear different perspectives, because we are going to have doctors on that disagree. And that's how innovation happens, right? Is by having different voices and, to back these things up or to challenge them, So I think it's really good that we were able to have that different point of view,
Correct. Yes.
Yeah.
Definitely.
Yes, indeed. 100%.
Well, let's go around, do our classic sign-offs.
We're ready.
All right. So this is Kim Carlos, because you've been listening to me run my mouth for an hour now, kind of. I was better this time, wasn't I? I let people talk more. I'm getting
You're
better.
so funny, of course. You're so...
You were fine.
It's a problem when you're really passionate about something. You're like,
Yeah, you're excited. You want to, yeah.
Yes. Well,
Makes total
so
sense.
for me, like the whole reason of this podcast is I hope that there are people out there that are doctor averse, that don't want to go to their doctor, but I want them to know that there is actually help out there now. I want you to know that you're not alone. I want you to know if you're struggling with obesity or another metabolic issue, it's not your fault. It's not your fault. And a lot of obesity is being alone. So you aren't anymore. Come join our community. We'd love to have you, and go talk to your doctor. So I'm always going to say osso la pasta because that's my thing. But let's go on to Kat. What is your classic sign-off, Kat?
It's true, like you're not alone. And a big part of binge eating, where you and I are recovering from, is isolation.
And shame.
You're not, and shame. And once you come out of the shadows,
Yeah.
and not be so secretive. That
There you go.
Yeah, come out of the shadows. Come to the light, Carol Ann.
Yes.
Carol Ann.
Kat, it's
I'm a Gen Xer. No one's going to understand this unless they were born in the 70s, maybe early 80s. So,
I feel very sure that the majority of our audience is likely 35 and above. So just because that's me, so having fun with these things. So, you're fine.
But anyway, I'm going to go back to old Katharine Hepburn because I love it. Always be yourself. Never give up. And don't put too much flour in your brownies.
Yeah, exactly. All right, Janine, what's yours? Your grandpa said it real well last episode. What was it? It was so poetic.
She said so much.
No, it was like, you're like, well, it was marathon, not a sprint, but he said it real special. I can't remember how he said it, but it was good.
Oh, God.
That's a good one.
Look, and that's what happens when you're born in the 70s. You can't remember. You have to look at the video.
I was born in the 70s too. I can't remember shit.
to remember. But yes, you know what? You never know who is watching you. Be an advocate for be an advocate for yourself. Because you never know how that will inspire someone else. And
so true.
And it's a marathon, not a sprint, with everything. And you just pace yourself, and everything really does work out. It really does.
Yeah, it does.
Yeah.
Well, this has been episode 6 of our podcast, and this house is clear. So
this house is clean.
I have exercised the demons. Thanks, everybody.
Thank you.
We'll see you next week.
Thank you.